Imagine lying in a hospital bed, steady and prepared for the long hours of labor ahead. Then the monitors erupt into loud, continuous alarms. Nurses rush in, followed by doctors moving with calm urgency. Something has changed, and the delivery you expected now requires immediate medical action. In this video, we will explore what obstetric emergencies are and how they are managed. So, labor is already a very physically demanding and emotional experience. Occasionally, complications arise that threaten the well-being of the parent, the baby, or both. When these complications escalate to a point of significant risk, they are known as obstetric emergencies. Approximately 15% of pregnant individuals experience a potentially life-threatening complication during pregnancy or childbirth. These emergencies range widely, from hemorrhage to more unusual events such as uterine inversion. When an obstetric emergency occurs, immediate medical intervention becomes necessary, often involving specialized equipment, rapid decision-making, and coordinated teamwork. So, in a hospital setting, teams have access to a broader range of medical tools and procedures. Each emergency requires a specific response. Interventions may include assisted delivery, medications, surgical procedures, resuscitative measures, and continuous monitoring. In case you're having an obstetric emergency at home, call 911, and while you wait, if you're bleeding heavily, lie on your left side, place a clean pad or towel, keep track of the amount of bleeding. If your water broke and the fluid is green or brown, this may signal fetal distress. Lie on your side. If you're having a seizure, do not restrain yourself. Roll to the left side, clear space around you. If you're having severe shortness of breath or chest pain, sit upright if possible, loosen clothing, keep airway open. Now, let's look at specific obstetric emergencies and how they are managed in hospital conditions. Amniotic fluid embolism. Amniotic fluid embolism, or AFE, is a rare but life-threatening emergency that occurs when amniotic fluid, fetal cells, or other debris enters the parent's bloodstream. This triggers a severe reaction that may lead to cardiovascular collapse, respiratory failure, and significant bleeding. Because AFE is unpredictable, its risk factors are not fully agreed upon. Most potential risks relate to abnormalities involving the uterus, placenta, or amniotic fluid. Commonly discussed factors include uterine rupture, placental abruption, placenta previa, cervical trauma, eclampsia, polyhydramnios, cesarean delivery, multiple pregnancy, and advanced maternal age. Symptoms usually begin very suddenly, so that includes severe shortness of breath, low blood pressure, rapid heart rate, confusion, seizures, excessive bleeding, chest pain, or loss of consciousness. The baby's condition depends on whether the delivery happens before or after the symptoms kick in. So before the reaction, the outcomes are usually good. Afterwards, risks include oxygen deprivation, low Apgar scores, brain injury, or long-term neurological impairment. So here's a video of amniotic fluid embolism management training. We'll go through it step by step. As you can see, the patient started experiencing the symptoms. She started panicking all of a sudden, has loss of breath, and is losing consciousness. As an oxygen mask is placed over her face, she lost consciousness completely. Nurses called for help, then CPR is performed. Almost 2 minutes have passed now, and the patient is given epinephrine. also known as adrenaline, for the treatment of maternal anaphylaxis. So what it does, it rapidly opens the airways and reduces swelling. Now they are checking her pulse. One of the nurses calls that the patient is bleeding. The bleeding can be coming from the uterus or punctured sites where the epidural catheter or IV lines are, like in the skin. 4 minutes have elapsed. The patient is still unconscious, so a C-section is needed. As you can see, chest compressions are still performed during surgery. Okay, baby is out, possibly taken to an ICU for monitoring and care since it can have oxygen deprivation, low Apgar scores, or brain injury. Chest compressions continue. It is now 7 minutes. The medics register a pulse. So patient's blood pressure is still low, so they're giving her more epinephrine. But other than that, both the mother and the baby are saved. So that's how in amniotic fluid embolism medical management happens. Okay, now we're moving on to another example of an obstetric emergency, umbilical cord prolapse. Umbilical cord prolapse occurs when the umbilical cord slips into the birth canal before the baby and becomes compressed, reducing or cutting off oxygen supply. Risk factors include prematurity, breech presentation, unstable fetal lie, high fetal station, polyhydramnios, multiple gestation, or artificial rupture of membranes before engagement. So the parent may feel or see the cord, or healthcare providers may detect sudden fetal heart abnormalities such as bradycardia or variable decelerations. Effects on baby include reduced oxygen flow, risk of hypoxia, potential brain injury, or without treatment, stillbirth. So how this obstetric emergency is managed? So obviously immediate call for help, then manual elevation of the presenting part occurs. So as you can see here, one of the nurses inserts her fingers, here it's two, and presses on the presenting part of the baby to relieve pressure off the umbilical cord. In a real-life situation, she would stay in that position throughout the whole procedure, so the baby would have access to oxygen. The mother's positioning is also very important. She kneels on all fours, then lowers her chest and head to the bed, keeping her hips elevated as much as possible. So this is one of the most effective positions for using gravity to lift the presenting part off of the cord. In conclusion, obstetric emergencies develop quickly and require fast, coordinated action to protect both mother and baby. Conditions like previously mentioned amniotic fluid embolism and umbilical cord prolapse demonstrate how crucial rapid intervention is in preventing severe hypoxia, long-term health complications, or loss of life. Although emergency interventions involve risks, they are essential for ensuring safe outcomes. Effective teamwork, decisive action, and skilled clinical care form the foundation of safe, responsive maternity practice. Other than that, that was my presentation. I hope you now have a better understanding of what an obstetric emergency is, how it is managed, and generally what type of complications a mother can face during labor. Thank you for watching.